Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Ever heard of balanitis? Not quite the topic of everyday conversation, is it? This is a condition that might not be widely recognized but is more common than you would think. Balanitis is an inflammation that specifically affects males. It's important to be aware of it because, while it's usually not serious, it can lead to discomfort or even more significant health problems if left untreated. So, let's dive in and understand what balanitis really is. Firstly, let's talk about what causes balanitis. This condition primarily results from a lack of proper hygiene in the genital area. Regular washing is crucial to remove the buildup of smegma, a substance that can cause irritation if left to accumulate. Balanitis can also be triggered by infections, both bacterial and fungal. Yeast infections, in particular, are common culprits, as the warm, moist environment of the foreskin can be a breeding ground for these organisms. Additionally, balanitis may be caused by irritants. These can range from soaps, shower gels, and lotions to laundry detergents that are not thoroughly rinsed from underwear. Condoms and lubricants can also cause irritation if you're sensitive to the materials or chemicals they contain. In some cases, underlying conditions like diabetes or a compromised immune system can make one more susceptible to balanitis. Knowing the causes is the first step to prevention, but what signs should you look out for? Now, how to identify balanitis? What are the signs and symptoms? Well, balanitis often presents itself through a variety of symptoms, each varying in severity. The first sign is typically redness. This isn't just a slight pink hue, but a noticeable, fiery redness that covers the glands or head of the penis. Accompanying this redness, you may also notice swelling. This can make the penis look larger than usual and can sometimes be quite uncomfortable. Next, itching is a common symptom. This isn't your run-of-the-mill itch, but a persistent, nagging sort that simply won't go away. Pain is another symptom to watch out for. This pain can be localized to the glands or it can radiate down the shaft of the penis. Lastly, some individuals may experience a discharge with an unusual odor. Though these symptoms can be rather alarming, remember that they are your body's way of signaling that something isn't right. With these symptoms in mind, how then is balanitis diagnosed? Diagnosing balanitis is quite straightforward. Typically, a healthcare provider will first perform a thorough physical examination. This involves a detailed look at the affected area, checking for visible signs and symptoms. But how do we confirm a balanitis diagnosis? It's through lab tests. These tests might include swabs from the affected area to identify any bacteria or yeast. In some cases, a blood test may also be conducted to rule out underlying conditions like diabetes. Once diagnosed, what's next? Treatment, of course. Now, on to the treatment options for balanitis. When it comes to treating this condition, there are several paths that can be taken. One of the first steps is often medication. Antifungal creams or antibiotics may be prescribed, depending on the cause of the inflammation. But treatment doesn't just stop at medication. Good hygiene practices are crucial. Regular cleaning of the area with mild soap and water can help prevent further inflammation and speed up recovery. But remember, don't overdo it. Excessive washing could exacerbate the condition. In some cases, if balanitis is recurring or severe, circumcision might be considered. This surgical procedure entirely removes the foreskin, eliminating the environment where the infection thrives. It's important to remember, though, that treatment options depend on the individual's condition and medical history. Always consult with a healthcare professional for the best course of action. But wouldn't it be better to prevent balanitis altogether? Prevention is always better than cure, and balanitis is no exception. Adopting good hygiene practices, especially in the genital area, is a primary strategy to prevent balanitis. This includes keeping the area clean, dry, and free from irritants like harsh soaps or untested lotions. Moreover, safe sexual practices, such as using a condom during intercourse, can also help in preventing this condition. By being mindful and proactive, we can significantly reduce the risk of balanitis. So there you have it, a comprehensive look at balanitis. Now, let's quickly recap what we've learned about balanitis. It's an inflammation of the glands or the head of the penis caused by various factors like poor hygiene or an infection. The signs and symptoms can include redness, itching, and discomfort. Diagnosis is typically through physical examination and sometimes lab tests. Treatment options range from antifungal creams to antibiotics, depending on the cause. And prevention? It's mostly about maintaining good hygiene. Remember, knowledge is power. Stay informed, stay healthy. UMCC, your ultimate medical consultants connectors.